Good day. I'm very pleased to have the opportunity to interview today Professor Gabriel Scally. And Gabriel is the President of Epidemiology and Public Health at the Royal Society of Medicine. He's a person very much in demand for interviews at the moment, so I'm very grateful to Gabriel for giving us this interview. We're not going to be dwelling on COVID-19 or matters like that very much in this interview, Gabriel, as you'll be pleased to find out. It's more about your family's links with the Glens and your memories of spending your early childhood and teenage years in the Glens. So I'll let you over to you then. I'll let you start.
Oh, thanks very much, Paul. Delightful to talk to you as ever. It seems only like yesterday, you know, we were sailing around the bay in Cushendall. Yeah, my family's links to the Glens on both sides go back a long way. My father perhaps more closely than my mother's side. My father was born and brought up in Ballycastle, on the Fair Hill in Ballycastle. And he did medicine in Dublin, in the Royal College of Surgeons in Dublin. And one of the things he did as part of his postgraduate work was he was a GP in Cushendall for several years, which was really important to him. And he worked with Dr. Alex McSparren in Cushendall. And then he went on to be a psychiatrist and worked with people with learning difficulties. But he met my mother actually in Belfast, and my mother's family have very strong links as well. And your
mother is Hopkins, isn't that right?
Yes, my mother's maiden name was Hopkins, and her mother's name was Moore. But before she was Moore, she was a MacDonald, and she was from the Green Valley in Glenanne, and they very big family in McDonald's, and they went back and forward to the US at various times, California, Pennsylvania. She happened to be born in Cushendall, and grew up there, and had a lot of relations around there, and still have from that side of that side of the family as well. So, and some very close ties, I think, as you drive around the place. In fact, though I didn't know it as a child, my grandfather, my great-grandfather, William Moore, was an architect, a Belfast architect, and my mother, who was MacDonald, married him. And he was the architect for two of the Catholic churches, the one in Cushendall and the Bay Church in Glenariff. So both sides, very close links.
I remember hearing a story that you told me of. I think it must have come from your granny going with her father, who would have been the architect, from Belfast to see the new church in Glenariff. Was that right?
That's right. And I only heard, she told us this sitting in the Bay Church at my sister Helen's wedding. And she said, you know, I said to her, you know, it was your father was the architect for this church, wasn't he? And she said, yes. And she said, and I remember coming down with him to inspect the works, I think was the phrase she used. And they came down on a train, changed trains at Ballymena from Belfast, and got the train down to Parkmore, and then got a jaunting car, as she described it, down to the Bay Church to inspect the proceedings. So that must have been in 1916 or 1917. And it was just amazing, her being there as a small child, and then almost 100 years, you know, well, 90 years later almost, being there at her granddaughter's wedding.
Yeah, that's fascinating. That's a long link with the Glens, right enough. Just before we move on from your family's connection, this is a connection your father had. It wasn't to the Glens, but was with quite a famous person in Dublin. And I remember you telling me about your father being asked to pronounce someone dead.
Yeah, my father told us, I remember when he told us this, it was, he never talked about it, but one day he was telling me about being in Dublin, and he knew I had some interest in Irish Labour history, and he told me that he'd pronounced Jim Larkin dead. And I say, what do you mean you pronounced it? He said, well, he told me he was a medical student, and he was living in the hospital, in the Meath Hospital, in January 1947. And he had come back from a dinner or something like that, and he was going up the staircase inside, and someone heard him, and a nurse came out from the ward and asked him, would he come in? And medical students, well, one of the jobs they did at the time was they had to confirm that someone was dead before they could remove the body to the hospital mortuary. And he pronounced to Mr. James Larkin dead. And it wasn't until a couple of days later, when the whole of Dublin came to a halt for Jim Larkin's funeral, that he realized it was that Jim Larkin that he
This
actually
was the person known as Big Jim, the founder of the Irish Labour Party and the Irish Citizens Army.
Yeah. And funnily enough, I met a very senior Irish civil servant during some work I was doing in Dublin, and we were just, we'd had, again, had dinner together, and we were just walking home, and I was talking about Dublin, and he was asking, did I have any connections to Dublin? I said, well, two, really. My father went to medical school at Surgeons, and secondly, he pronounced Jim Larkin dead. That was the other notable connection. And he stopped dead, and he said, that was my great-grandfather, you know. Very interesting.
Amazing coincidence. So really then, moving from your family connections, what about your own memories of Cushendall, coming to it from Belfast, when Belfast wasn't in very good shape in those days, as you'll recall, coming to the liberty, let's say, the freedom of the beach and the bay at Cushendall?
Well, I love the place, and it is, you know, deeply ingrained in my earliest memories, because my grandfather and grandmother always had a house in Cushendall for, you know, since before the Second World War. In fact, they moved to Cushendall and lived in Cushendall for the duration of the Second World War. And my mother always went to school in Ballycastle, so they were always there. And they were there all summer, and came down religiously every weekend, left Belfast at about 4:30, I think, on a Friday, and drove down. And I would come down with them, with my mother, and then my father would come down. So we'd be in and out of their house all the time, every weekend, and I'd be there for a fair bit of the summer as well. So it's in my absolute earliest memories, because there was such, and you know, as you got a bit older and roamed around the place, the liberty was amazing. You were kind of expected home for your tea, and that was about it. And you were very, you know, carefully instructed not to drown along the way. But apart from that, we were left to do whatever it was. And then, of course, when the Troubles started, it really was wonderful, because we were there, you know, Monday to Friday, but Friday afternoon we were out of the place, and it was deeply, deeply difficult, because we were living in Andersonstown, right on the road there, and I was going to school up and down the Falls Road, and it's terrible times.
Yeah, but let's remember Cushendall rather than Belfast at those times. So you'd have been out in boats, you'd have been climbing mountains, you'd been, what else would you have been at?
Well, the sailing was a big bit of it, and the sailing club ran a course every summer, and when I was old enough, I think I was sent on that, and I still have a photograph of us all standing in large number outside the wooden clubhouse, as it was. It was in Dalriad at that time, though I do remember them when they used to start the races on Limerick Point in Cushendall. But I remember that clubhouse, and I made you always do on sailing courses, you know, you make great friends. And I made a tremendous number of friends there, and people I would still see, you know, and I bump into people all the time who I've met on courses. And when I was a medical student then, Paul, what was I going to do during the summer? Because there wasn't very much to do during the summer at those times, and it was a long course, it was 6 years. So I did my coaching qualifications with the Sports Council, and I became a senior instructor for the Sports Council, and I wandered around the place teaching all summer, and I got really to love places like particularly Carlingford Lough and Rostrevor, and I had just a great time. And I was a real privilege then to teach courses in Cushendall as well.
Very good.
So that was certainly one of it. And then, you know, there was always fishing to be done. If there wasn't enough wind, then it was great go out fishing and do things like things I'm sure you rarely see these days, spearing flatfish at low tide on a calm evening in the bay, or putting down long lines for fish, and wonderful. And then summer occupations were you know, selling some of that fish to anyone who would buy it, and especially the mackerel. I suspect that probably hasn't changed. But and then gathering dulse, and you know, myself and Henry Johnson in particular used to go out in the boat at very low tide on a calm day, pull up the dulse, dry it on the corrugated iron roof of my granny's garage, and then sell it to the McElroys on the beach at Cushendall. They put in little paper bags and sell it to the tourists.
That's right. John McElroy, very often referred to as Dixie. People still talk about when Dixie's hut used to be on the beach, you know.
Indeed.
That would have been the person he'd been selling it to. He had a brother, Jimmy, who was blind, and his sister, Mag Roy, as she was called, ran the sweetie shop that would have been there beside the hut.
I do remember the huts, and I remember the nuns having a hut over on the other side of the river. There
That's
is
right.
There as well.
The bathing huts. Yeah.
The bathing huts. And then the autumn source of revenue was going around the hedgerows and gathering rose hips, because there was the factory in Glenarm at that time that made rose hip syrup, and getting your fingers torn to pieces collecting rose hips for $6.60 a pound, I think it was, in Charlie Hamill's shop in the village.
Right. Charlie Hamill was the agent for the rose hips. That's right. Yeah, and we brought them down then.
So they're great times, and you know, all of that, the sailing and going around the coves and sailing around to Cushendun, and then as the sailing went on and there began to be some bigger boats in the bay, or at least we thought there were bigger boats in those days. They weren't particularly big, but sailing across to Southend and round to Campbelltown. And when you think of what we did it with, you know, in terms of maps and navigational aids, they were few and far between. I remember borrowing my father's Russian radio, which had a little movable aerial at the top of it that you could use as a direction finder, and crouching in the cockpit of an 18-foot thing.
Not quite a GPS then.
Not quite.
So anyway, moving on from the carefree days of Cushendall and boating and all that involved, you went to Queen's, you graduated from Queen's. I'll go very quickly through your professional career here. Graduated from Queen's in 78, and then you did a master's in community medicine in 82. Trained as a GP, but you were director of public health at the Eastern Health and Social Services Board. I think when it was there, you set up Young People's Sexual Advice Centre, isn't that right? That was quite controversial at the time.
It was extremely controversial. To my amazement, it was controversial. I thought it was pretty obvious. There was a lot of births to unmarried mothers, and a very substantial number of them were unplanned. And of course, there were a lot of women going to have terminations in England. And I thought, well, the good public health principle, prevention's better than cure. So I wanted to do something to provide contraceptive services to young people, because there wasn't really a service for them. There was the family planning service, but they would look askance at you if you didn't have a wedding ring, and you know, they weren't very sympathetic to young people, and there was no counselling involved at all. So I invited over from England a service called Brook Advisory Centres to set up a place there, got money in the board, and goodness, all hell broke loose. And I was accused of you know, destroying the moral backbone of the province, which was very odd given the bombs and everything else that was going off around me, that I was the one who was destroying the morality of the province. But tremendous people running it, and the young people were fantastic as well. And the service is still going, and it survived judicial review. I survived death threats and all sorts of stuff, and I'm very proud of it. I'm very proud of those young people, and of the staff. The wonderful doctors and nurses kept that service going for young people, let them make up their own minds.
Yeah, thank you very much. And then you moved in 93 to England. You were regional director for um, your two different titles there, but I think there was reorganization in the middle of it, of the areas you were regional director of. Isn't that right?
That's right. I was reorganized so many times. I had to reapply for my job, which was regional director of public health. I think I reapplied for it 8 times
Goodness.
along the way because there were so many reorganizations. And it was very different in England. There was a tremendous emphasis on how well the services were performing. And if services weren't performing, well, then, heads would roll. You'd change the board or the trustees or the chief executive and stuff. And that was a big shock to me coming from Northern Ireland, where no one ever got sacked. They were more likely to be promoted than got rid of. And performance wasn't, it'd be nice if it was running well, but it wasn't an essential at all. And I don't think much has changed, I'm told, either.
Well, I think that actually what you've just said there is a good link, because along with Sir Liam Donaldson, you then became heavily involved in either defining and or highlighting clinical governance, which is really making sure that health service organizations pay attention to how well they're doing and try to improve their performance. Isn't that really what it's about?
Indeed, Liam Donaldson was a good friend, and he was another regional director of public health at that time, though he went on to be chief medical officer for England. And I knew his father before I knew him, because his father, Paddy Donaldson, was a public health doctor from Tyrone. And Liam and I both had to get involved because of our roles as really the regional medical officer and these were big regions, so there were 5 million people in my region, about the same in Liam's. So things went wrong, and we had to get involved in sorting things out, some of them terribly serious and very, very important. And we came up with this concept of clinical governance. It really piggybacked on what was happening in the business world in terms of corporate governance and a thing called the Cadbury Review of Corporate Governance. But we applied it to health services, and it was really about how you improve health services and make sure people are getting good quality health services, but also when things aren't right and when things go wrong, how you put them right. So both of us got very involved, and we came up together with this concept of clinical governance. And Liam did a fantastic amount of work on it and continues to do work, even though he's no longer chief medical officer, retired 10 years ago, but he still works for the World Health Organization as one of their major people in patient safety. So that was a very important part of the work, really.
Well, I suppose as someone who was synonymous with the concept of clinical governance, it was no surprise then that you were called in when there was what they called clinical failures, when things went wrong. So you then became associated with a number of inquiries, isn't that right?
Yes, in various ways. I had inquiries in my own region that I've been involved in setting up, and also where my actions were looked at to see if I'd handled some of these things well. And I was, luckily enough, they did think I'd done a good job along the way. And then when things went wrong elsewhere, I was asked to assist in them, and I got invitations to come and help services out. And actually, to Northern Ireland was one of the places where I did some work with the hyponatremia inquiry, which is the longest running public inquiry I think there's been. 14 years it took into the deaths of five avoidable deaths. At least 4 of them avoidable, if not all of them.
And is it fair to say that you may have been appointed to some of these inquiries, not just because of your ability and your expertise and your experience, but also because of your tendency to speak out and not be worried about rocking the boat?
Well, yeah, funny you should use that phrase, because I remember when I was a trainee in public health, someone, a retiring consultant, John Black, in fact, this was his name, and we were saying farewell to him with, tea and buns one day in the offices in the Eastern Board. And he said, well, his advice to the trainees, says he, looking at me, is not to rock the boat. And I pondered his wise words, and I thought, no, I don't really, I'm not, that's not me. I says, so what I tell the trainees is, one of your jobs in public health is to rock the boat. And what you must be careful to do is rock the boat when it needs it, but don't capsize it.
Just something that I became aware of in March 2012, you resigned from England's Department of Health because of the government's health policies at the time. It was a Conservative Liberal Democrat coalition government. And what I'm looking at here is a quote from the Guardian newspaper where you said that the government NHS policy is deliberately assisting what you called the circling birds of prey of the private sector, seeking to make big profits out of healthcare.
Yeah.
I'd like to comment on that.
Well, it was a pretty accurate quote. It was actually written by Dennis Campbell, who's from Northern Ireland, and he did it. And I don't think I used birds of prey. I used vultures, I think, but he thought maybe birds of prey might be slightly better. But no, I was very concerned by what was happening. I could see the privatization of the health service and the destruction of the structure, the destructuring of it, and what was left of the structure. Well, they abolished regional health authorities, they abolished local health authorities, and most of it was given over to a entirely different approach, which was one of commissioning and contracting organizations. So no one really seemed to run the system anymore, and I was very fearful of that and the implications of that. So I didn't really see how, even though I had years to go until retirement, I didn't see how I could stay in the system.
Just when you mentioned the work you were doing in Ireland, I forgot to mention the cervical scan work that you did that I think you got it in a report called the Scally report, and certainly made a big difference, shook things up in the health system. And recently I learned about it from the Late Late Show on RTE through Vicky Phelan, who was on talking about the whole, well, the experience of having been mistreated in a system like that.
Yeah, it was very interesting. I knew this was happening. This major crisis was happening. It didn't receive that much coverage in the North. It was really about a failure of their cervical screening system, in that they had looked back at the slides of women who had developed cervical cancer to see if they'd had screens previously and to see what they could learn from the slides from years ago when they'd been screened about the development of their cancer. And they had found a group of women, about 200 odd women, who had their slides looked at retrospectively, and they thought on that retrospective look that there was signs of cancer that should have been spotted at the time and something should have been done. And those women then weren't told about that. And then eventually Vicky Phelan really broke the dam on it through taking a case in the High Court and refusing a confidentiality settlement, and spoke very publicly on the steps of the High Court, and the whole thing blew up. And then I was sitting at home here in Bristol one Sunday afternoon, and I was asked, would I come and do a scoping inquiry into the this, and I said, yeah, I'm very happy to help. And I said, when would you like me to come over about this? And I expecting we'd agree some date for it and so on. But in fact, I had to appear there on Tuesday morning. The cabinet was meeting. This wasn't the Sunday afternoon. I had to be there on the Tuesday morning. The cabinet was meeting on Tuesday. Between then and between Sunday and Tuesday, the terms of reference had to be written, sent out to all parties, all the political parties, agreed with all the political parties, my appointment approved by the cabinet and the terms of reference, and then I had to have a press conference to announce it. So there it was, and the pace did not stop then for a long time, and it was quite a remarkable experience and a brilliant experience meeting Vicky Phelan and the other women and the families who've been involved. And it was easily the hardest thing I've ever done in my life, easily, by a long way.
You've just answered my next question, and I was going to ask you, of all the pieces of work, the hardest. Could I maybe just throw another question in, and that is, what would you say has given you the most satisfaction in all the different pieces of work that you've done?
Well, I think the cervical check report and getting that through and getting the voices of those women heard and tracking down all these amazing things that happened, like there's slides being sent all over the United States to laboratories that no one in Ireland had any idea where their slides were going, and finding all these problems in the whole thing, and then putting that together within what was an extraordinarily short period, about 3 months, and answering, I think, all of the questions that people had about it. And one of my, as you said, intimated earlier on, well, I don't hold back about saying things, so I was very blunt about the ills that have been done to these women along the way, but I was also very blunt that they need to get on and fix it. So I was meant to be setting the pitch rolling, to use a cricketing metaphor. You know, you have to learn these things when you're in England. Pitch rolling, for a full public inquiry type thing, which would have gone on for years, cost millions of euros, and might have delivered, and nothing would have happened in the meantime. And I said, well, I gave them 50 recommendations to put this thing right, and said you don't need a public inquiry, and I got away with it all. And it was you know, very gratifying. And the thanks I got from people, I don't look for thanks, but it's lovely when it comes. So that would definitely, but to go back to the Brook Advisory Centre thing, I think that was so worthwhile, I think, so worthwhile. And just, I remember when I was leaving to go to England and my departure had been announced, and a couple of times I've just stopped on the street, I was walking around Belfast, and a woman would stop me. Twice it happened, stop me and say, I know you're going, I think it's a terrible shame. I just wanted to thank you for what you've done. Mm-hmm. And that's...
You say it's nice when it happens.
That's better than anything. You know, they're obsessed with OBEs and stuff like that over here, but that's better than anything, you know.
Yeah. Coming from the policy level, and just finally, Gabriel, down to the practical level, from your perspective to the ordinary man in the street like myself, what's the advice to take us through and out of the COVID-19 pandemic that we're in? What's the advice for the ordinary person in the street?
Yeah, no, we're a very dangerous place. I mean, the first thing has to be, if you are offered a vaccine, go and get the vaccine. And it doesn't matter what of the vaccines it is, anyone you have been offered will have been approved. And sure, it mightn't be 95% effective, but take it. And there'll be plenty of time, because there's going to be a vast glut of vaccines produced, just not at the moment, but in 6 months or a year's time. And there's no reason why you can't have another vaccination top you up. So if you're offered a vaccination, take it. Second thing is, keep yourself safe, because I don't think, you know, you asked me what were highlights of my career. Well, I think the low light of my my career time in public health is just this feeling of dismay about how we've handled it in Britain and Ireland. How of all the islands in the world, we've ended up with the worst record of deaths and disease from COVID-19. And I think I'm so sad about that. And I feel personally apologetic that I should be apologizing for a public health system having let the people of these islands down. So I think people should rely on themselves. You can't rely on the system. Rely on yourselves to keep yourselves safe. And that means, you know, social distancing as much as you possibly can, at least 2 meters if you can, outside, open windows. And if you happen to have to be in a place, in a shop or a house with other people, or a factory with other people, and it should only be essential reasons, make sure the ventilation is fantastic. You know, I've hated drafts all my life, something I got from my mother and my father. Hated drafts, but I'm learning to love them now. I think they're great things. And wear a face mask whenever you can, and the better a face mask, and hand sanitizer, all that just standard stuff, because we're going to have to keep ourselves safe for some time. And it's not just about the deaths, it's about people getting long COVID as well. The 1 in 10 who will get symptoms that won't go away, or symptoms that come to them later and disturb their lives, if not destroy their lives. So absolutely, just keep yourself safe.
Thank you very much, Gabriel.
No, thank you very much. And I look forward to seeing all my friends in the Glens as soon as I possibly can, as soon as I can.